Hey everyone, today we're going to break down a really common but kind of misunderstood cause of back pain. It's called spondylolisthesis. I know, it's a mouthful, but stick with me because we're about to make it super simple to understand.
So, let's start with a feeling you might know all too well. You're walking, maybe just around the block, and this ache in your lower back just starts creeping in. And the longer you walk, the worse it gets. If that sounds familiar, well, you're in the right place, because that's a classic sign of what we're talking about today.
So what in the world is this condition? The key to understanding that big, complicated medical term is actually a much simpler phrase that you've probably heard before, a slipped vertebra. Let's dive into what that actually means.
Okay, so spondylolisthesis is just the official name for when one of the bones in your spine, one of your vertebrae, slips out of its proper spot. That term, slipped vertebrae, is actually a perfect way to picture it. One of these bones has literally shifted out of line with the others.
And when one of those bones moves out of place, you can bet your body is going to send you a signal. The most common one? You guessed it, lower back pain. For a lot of people, this is the first and main sign that something's not quite right.
But that just begs the question, right? Why does this even happen? I mean, how can a solid bone like a vertebra just slip out of position? Well, the answer isn't really about the bone itself, but more about what's supposed to be holding it in place.
See, your vertebrae are held together by these tough, fibrous bands called ligaments. The slip happens when these ligaments get weak and can't do their job of holding everything in that nice, neat alignment anymore. It's that weakness that lets the vertebra start to move.
So what makes those ligaments weak in the first place? Well, it can come from a few different things. Sometimes it's just a natural part of aging and wear and tear. Other times it's from a specific injury or trauma. And for some people, it's just the way their bones were formed from birth.
Now, while lower back pain is super common, it's definitely not the whole story. When that slipped vertebra starts to get in the way of your spinal nerves, you can start to feel the effects way beyond just your back.
And this is where things can get a bit more serious. If that vertebra starts pressing on near my nerves, patients can get numbness that shoots down their legs. And that nerve pressure? That's what often makes it harder and harder to walk very far. Which brings us right back to the symptom we talked about at the very beginning.
Okay, so we've got a handle on what it is, why it happens, and what it feels like. But from a doctor's point of view, not all cases are created equal. They actually classify the condition based on its cause and just how bad it is so they can figure out the best way to handle it.
You see, doctors have different names for it depending on the root cause. For example, degenerative is the most common and is really just caused by the aging process, but something called isthmic is often seen in younger athletes and involves a tiny stress fracture. Getting this specific is absolutely crucial for picking the right treatment.
Now, besides the type of slip, doctors also measure how severe it is, and they grade this on a really simple scale, with just 4 stages. This number tells them how far out of place that vertebra has actually moved. These 4 stages show a clear progression. Stage 1 is just a mild slip, but as you move up towards stage 4, you're talking about a very severe displacement. And this staging is so important because how far the bone has slipped is directly related to how much it might be affecting those spinal nerves.
And that's exactly why those later stages are taken so seriously. As that vertebra slips further and further, the chances of it pressing on the spinal nerves go way up. And that can lead to some major neurological problems, like constant numbness or weakness in your legs.
So, knowing the problem is the first half of the battle. The next part is all about management. What happens next really depends on when the condition is diagnosed and at what stage.
When you boil it all down, the goal of any treatment is to solve this one core problem. You have to relieve the pressure that the slipped vertebra is putting on the nerves. That's it.
And this brings us to what might be the single most important takeaway here. If this is caught early, it can often be managed really well with things like physical therapy and targeted exercises. But, and this is a big but, if it's left to progress to the more advanced stages, surgery often becomes the only way to physically go in there and take that pressure off the nerves.
So it really makes you think, doesn't it? Is it time to get a clearer picture of what's causing your back pain? Because knowing what's behind the symptoms is the first and honestly the most powerful step you can take toward finding a solution. We hope this gave you a solid foundation for understanding spondylolisthesis. Thanks so much for watching.